With closures and quarantines worldwide, many are beginning to wonder, what happens when cases of coronavirus start to decline? And when can we go back to normal?
You don't make the timeline. The virus makes the timeline.
By now, you're familiar with the phrase, flatten the curve.
Flatten this curve.
Flattening of the curve.
Depress the curve.
As the pandemic of 1918 spread across the United States, some cities like Philadelphia carried on as normal and saw a spike in cases. Others, like St. Louis, closed businesses and schools and avoided that spike. But in 1918, another city presented another lesson that showed the dangers of lifting quarantine too soon. On the question of when coronavirus quarantines should come to an end, what happened to the city of Denver, Colorado a century ago could serve as a warning. October 1st, 1918. Even while several in the city are hospitalized due to flu-like symptoms, Denver's public health manager denies that the city has any cases related to the pandemic. By October 6th, the flu has overtaken the city. City officials scramble to institute a mandatory closure of all public places, except essential businesses. Over the coming 2 weeks, the curve begins to rise as more and more deaths are reported around the city. But by October 20th, the curve appears to crest, and the death rate begins to drop. Health officials in the city begin to think their battle with the flu is over. The mayor and business owners become increasingly eager to reopen, and after another week of decreasing numbers, Denver reopens on November 10th. The next day, World War I ends. With all restrictions on distancing lifted, thousands flock to the streets for an Armistice Day celebration. But the pandemic was far from over in Denver. No more than 10 days later, signs that the city opened back up too soon became clear as the death toll rises again. In an attempt to combat the second spike in cases, Denver officials try to close the city back down, but businesses refuse. More and more cases overtake the city, and tensions grow between the city and its businesses. Meanwhile, without much evidence, the mayor and health officials start to blame immigrants from Italy and Eastern Europe for the second rise in cases. Ultimately, the second peak of Denver's battle with the 1918 pandemic results in even more deaths than the first spike in cases.
It was worse than the first because there just wasn't the will to implement another round of closure orders. Business owners were not going to stand for another closure order.
Dr. Navarro is a medical historian whose research team at the University of Michigan is responsible for much of what we know about the 1918 Spanish flu.
I think that the real lesson is not necessarily for public health officials who know this already. I think the real lesson of Denver is for the general public we can say this is what happens when you don't keep these non-pharmaceutical interventions in place for long enough. There were lots of public health officials, lots of physicians who were telling the public, we're going to be through this in a week. They were trying to sort of impose, or at least give the information to the public that they were the ones who were in control of the disease. And that was definitely not the case. We're always behind in terms of the data. They were behind in 1918. We're behind today. So strong public health leadership, the best data possible, people willing to make hard decisions based on that data, that's how you get the best outcome.